Good morning and welcome everyone. My name is Michelle Cunningham, Marketing Outreach at the Healthcare Workforce Development within HCI. Before we begin the webinar, I'd like to review a few housekeeping items. The webinar will be recorded and posted on our website. The slide deck will be posted soon. The chat option is disabled, yet there will be multiple times throughout this webinar for question and answer sessions. And I would like to introduce our first presenter. Happy to do so, Ken Rozelle, our Deputy Director of Healthcare Workforce Development. Thank you.
Thank you, Michelle, and welcome everyone to this webinar. As Michelle said, I'm Karen Rozelle. I'm here at Healthcare Department of Healthcare Access and Information, HCI, a Deputy Director with Healthcare Workforce Development. Next slide, please. So in this webinar, we have an agenda to walk through a few things today. We're excited to be able to share with you information about our psychiatric education capacity expansion program. Let's see if I can. So in the presentation today, I will walk through a little bit about our program. We have several of our team here today to walk through in detail information about the program, what it is, how it works, how to apply. So just for those of you that are familiar with us at Department of Healthcare Access and Information, in the last year, we transitioned from being Office of Statewide Health Planning and Development to our new department, HCI. And so I just wanted to spend a minute here talking about, so even though the name has changed, we changed from OSHPD to HCI, that our mission really has not changed. And that we continue to be guided by our vision and mission to ensure that every Californian has access to equitable, affordable, quality health care provided in a safe environment by a diverse workforce. And that's why the work that we're doing here today to present this program is really about building that access and building that diverse workforce. So the Psychiatric Education Capacity Expansion, long name, PECE, Psychiatry Residency Program, is a program that we established in 2019 to address being able to expand the capacity of California to train the number of psychiatrists and psychiatric mental health nurse practitioners needed in California. We know that there is a shortage of professionals, behavioral health professionals, who can serve the diverse needs of California and in the diverse areas and in the underserved areas. And so this program is really about increasing the capacity to train more individuals, increase the number of underrepresented individuals to receive training and practice, to support cultural and linguistic diversity. We recognize it's really important to build a workforce that serves California. And also to look at how are we ensuring that we have the care providing in the areas of need throughout California. And so this program this program was specifically designed to fund organizations to train psychiatry residents, child and adolescent psychiatry fellows, and addiction psychiatry fellows. And with that, I will turn the presentation over to our next presenter, Ann Powell, Health Program Specialist here at HCI.
Apologies. So the purpose of the program is, as Karen said, to increase the supply of psychiatrists and psychiatric mental health nurse practitioners trained to work in California. Next slide. There are 9 principles that are guiding the PECE program. The first is client-centered care for adults with or at risk of serious mental illness with a priority on early intervention. Likewise, provide care that is child and youth-centered with a priority on intervention. To ensure racial diversity, cultural humility, and a linguistically competent workforce. To conduct outreach to and engagement with the underserved, unserved, and inappropriately served. To use effective, innovative, evidence-based, and community-identified practices. Next slide. We also want to promote wellness, recovery, resilience, and other positive behavioral health, and shape the primary care outcomes of children and youth and their families. Include in this the viewpoints and expertise of persons with lived experience, to work collaboratively to deliver individualized, strength-based, consumer and family-driven services, promote interprofessional care by having professionals work across disciplines, and finally, we expect that the guiding principles will be used by grantees to inform their educational materials and training. Next slide. Grant program funding is available, as noted earlier, to psychiatry residency and psychiatric mental health nurse practitioner training programs. The allocation of funds to each of these disciplines will depend on the application evaluation scores, as well as geographic coverage across California. Next slide. We have 2 categories of funding. One is new programs to assist psychiatry residency programs to achieve accreditation by the Accreditation Council for Graduate Medical Education, ACGME, and for program expansion, of which the first year would be obtaining ACGME permanent approval of additional slots and development of programs content, and then launching the programs in years 2 through 5. Next slide. New programs specifically are 3-year grants, and the funding, we expect that grantees will obtain ACGME accreditation by June 30, 2025. The funds will be released in 3 payments, 25% upon execution of the grant agreement, 25% when select phases of work are completed, and then the balance of allowable expenses when HCI receives proof of work completed and the final report. Next slide. Expansion programs are traditionally for 5 years, recognizing it takes a year to develop the program, year 1, and then 4 years for actual residency training. Funds will be paid on an annual basis for expenses incurred, and ACGME approval of the expanded number of residents is required before any funds are released. Next slide. Grant program awards conditions are non-supplementation. That is to say that these funds cannot be used to replace funds the grantee has from another source for the same purpose. The funds do not cover administrative costs. These are built into the grant awards, and the award level granted will be the full, partial, or no funding based on the applicant's evaluation score and the amount of funds available. Next slide.
Thank you, Anne. We're going to go ahead and open up this period of time for questions. In order to, for all participants, you may raise the hand icon for questions. You'll find the hand icon on the top of your screen with the reactions button. Once you raise the hand icon, you'll be placed in a queue. I will call on you by your first and last name. Your mic will be enabled and you will need to unmute yourselves. To unmute yourself, the mic button is at the top of the screen. Again, the chat option is disabled. Please mute yourselves after you're speaking. If we're unable to get to all your questions, please feel free to email the address on this slide and we will respond after the webinar. So feel free to raise the hand icon. I will call on you. And I apologize for mispronouncing names. Jaya Ikambaram, please unmute yourself.
Hello, good morning, everyone. I'm from a psychiatry residency program in Stockton. It's a brand new program, and we are planning on expanding our residency program. So the question is, it takes some time for the ACGME approval for the expansion. So I just want some clarification. Let's say, like, we are submitting for this grant. The grant money will be released until we get the approval, or or is it like, we can go ahead and apply for the grant, and then if the ACGM approval is, by 2023 or 2024, we can get the funding. So I just need some clarification on that for program expansion.
Thank you for your question. The answer is that you do not need to wait till you have the expansion letter in hand from ACGME. We will need proof that your original program was approved. The residency positions that you currently have has been approved by ACGME. However, funds will not be released until we have the expansion letter from ACGME for the new slots.
Thank you. And then I also have an additional question. It's a brand new program. We are also planning on doing fellowship. We have some child psychiatry faculties, and then we are working on fellowship application for child psychiatry. And again, the same question, because it takes some time for ACGME accreditation for approval for child psychiatry fellowship, and also like recruiting residents for the fellowship. So shall we go ahead and apply? And then does it, the grant fund will be, anytime should we have to delay, or we can go ahead and approve until the accreditation from the ACGME?
Is your program already accredited?
We don't. Yeah, the residency program is accredited, but not the fellowship. It will be a new fellowship.
That's fine. That's fine, and we can go into that more detail later if you'll send an email.
Okay, thank you.
You're on mute, Michelle.
So sorry, thank you. Next, Andrew Nurola.
Yes, I was wondering if you could help clarify on the criteria evaluation, number 1, where it talks about the languages.
Yes, so it is our practice in our Song Brown program, which we are replicating here as a part of the process, that all health plans or health providers that accept Medi-Cal collect information about their language, their ability to meet language thresholds under Medi-Cal. So you should be able to get that information from all your primary rotations.
Thank you.
Thank you. Next, Hillary Gould.
Hi there. I was just wondering, for an expansion program, is there a cap on how many new residents can come into the program? And is it differ per year? So if we take, a couple the first year and then end up expanding it to 4 the next year, do we get funding? How is the funding worked out in that way?
At this point, the program is only able to fund one cycle. It could be that we'll have additional funding in next year, but at this point, the funding is for one cycle of 4-year residence. However, if you're adding fellows, because fellowships are 2 years, you could add subsequent years of fellowships.
Okay, and is there a cap on the number of?
There is no
Well,
cap.
Okay, thank you.
Thank you. Thank you for your questions. We're going to move on to the next session and we will have time for more questions as we proceed. And we're going to introduce John Madriz, Grants Management Section Chief, who will be talking about our next session. Thank you.
Thank you. Good morning, everyone. My name is John Madriz. I'm with the Grants Management over at Healthcare Workforce at HCI. I'm going to go over some of the application basics. On the webinar slides itself, you can see there's a link to an online application. That link is also located in the grant guide and on our website, the Behavioral Health Program website. And you can just go a direct link to it to start the online application. We also have a PDF version located on our website, and in it you can preview the questions before you go and fill them out online. We strongly recommend that you review the grant guide in its entirety before starting the online application. Most of your questions will be answered within the grant guide itself. And applicants seeking to support both psychiatry residents and child and adolescent fellows will use a single application. So the same online application you can apply to either to add residents and or to add child and adolescent fellows. Next slide, please. On your online application, you'll be asked to list current and or proposed field placement sites. You will ask to submit a letter of sustainability committing the sponsoring organization to support new or additional training sites when the HCI grant ends. This is to ensure that any grant funding, once it ends, that the expansion of the program will continue beyond the funding period. Next slide, please. In the budget, for the new psychiatry residency programs, eligible programs may receive an award up to $2.5 million. For expansion of existing psychiatry residency programs, eligible programs may receive up to $175,000 per first year new positions. Okay, I'd like to entertain any questions at this time.
Yes, thank you, John. I will go ahead and raise the hand icon, participants. I will call on you as you're placed in the queue with your first and last name. When you complete asking your questions, if you could go ahead and mute yourself back, and then we'll carry on. First question is from T.G. Baring, please. If you could unmute yourself.
Hi, the question was regarding the application evaluation scores. So we were just trying to do some internal score assessment. What I wanted to know is, are you able to let us know what was scores for previous grants that were approved?
Yes, you can always request for what scores you received on previous applications. We will be discussing the scoring process in the third segment of this event. However, if you've applied before for a grant, you can request to see how you scored on your application in previous application filings.
Wonderful, thank you.
You're welcome.
Thank you. Any other questions? All right, we can move on to the next section.
At this point, I'm going to introduce Kevin McAvilly. He's our research data specialist over at Healthcare Workforce.
Um,
Uh,
John?
all right.
Oh,
Sorry, everyone, some technical difficulties. Yes, so our grant application evaluation criteria, the scoring criteria for the grants was designed to align funding with the PECE guiding principles. The application will ask some questions about the program strategies in general, as well as some more specific questions about residency sites. For the program in general, we have some questions about recruitment strategies, workforce in areas of unmet need, and cultural competency strategies. And for more specific questions about the rotation sites, we have we'll be evaluating on percent of patients served who primarily speak Medi-Cal threshold languages, the payer mix of each residency site, the health score based on the HPSA mental health score based on the location of the rotation site, and also we'll be considering the geographic distribution across the state of applicant programs. Next slide, please. Each year we will ask for an annual report for each program that's funded. The report will be open on the 1st of July, and it will be closed at the end of July. Grantees will report on the number of applications and admitted residents, and anyone interested in serving underserved communities. Also, program participants will be asked about the use of PECE guiding principles in training materials and training, and how HCI funds support specific residents or are used for the entire cohort's training. Next slide.
Oh, I just want to briefly mention for the individual that asked about receiving their scores from a previous PECE application, our scoring criteria has changed. We'll still share your scores with you, but just keep in mind that the scoring criteria has changed from previous cycles of the PECE program. Thank you. Pardon me, Kevin.
Thank you, John. Thank you, Kevin. And again, raise the hand icon as I see folks are starting to do. I'll call on you. First question is from Hillary Gould. Please unmute yourself.
Hi, we wanted to know if partnership or consortiums can apply together.
Yes, they can.
And one more question, if we had interest in kind of applying to multiple programs, like a new program and an expansion, are we able to turn in both of those applications separately, or should we just do one?
For a new program and for an expansion program, those would have to be separate applications.
Okay, thank you very much.
Thank you, Hillary. Next, we have a TJ Baring, please. TJ Baring, please unmute yourself.
Thank you. This is expansion to previous question. Just want to check, can we apply together for a brand new psychiatry residency program as well as a fellowship program?
And can I pass that question to you?
Sure. Yes, you can apply. However, they have to be separate applications, one for the new and one for the expansion.
Thank you.
Thanks, Ed.
We can open it up to any questions you may have about this program in general. Go ahead, raise the hand icon, please. Hillary Gould.
Can you share more about how kind of funding is dispersed for the expansion? The new program, it's outlined well, but.
This is Ann Powell. Let me speak briefly to that. Funds are awarded to successful grantees, and then payments for new programs,
For expansion.
expansion, excuse me, will be done on an annual basis in arrears. However, first payment will require us to receive your ACGME approval of the additional slots that you are adding to your program.
Got it. Thank you.
Thank you, Hillary. Any other questions, please? Alan Louie? Please unmute yourself.
I arrived late. Can you tell me how we might get the recording?
Yes, it'll be posted on our website in the upcoming days.
Thank you.
You're welcome. TJ Baring, if you want to unmute yourself, please.
Hi, just a clarification on that scoring component again. What if we haven't applied in previous year? What we are trying to find out is what are the kind of generalized scores on which previous grants were issued? Is that an information that can be shared publicly?
John?
Yes, you can make a Public Records Act, a PRA, Public Records Act request for scores from previous applications from our last PE cycle. So you can make that request via email, and we'll respond to that request and provide you with the scores from previous applicants. But just keep in mind that the scoring criteria is different in this cycle than from the previous cycle.
Of course. Thank you.
You're welcome.
Thank you. Any other questions, please?
Okay, if that's all the questions, I will pass the mic back to Karen for closing comments.
Great. Thank you, everyone who has been here today. I just wanted to provide some final information about this program and some of our other work. Is just a reminder, this program opened last month, end of May, and it closes, the application closes on July 1. We encourage you to go to our website and check out any information that we have about this program, as well as our other programs. You will find the grant guide, the application information there. I also wanted to just let folks know about what we call our funding eligibility tool. And that is a short survey that we have that you can enter, individuals and organizations can enter in to find out what programs you might be eligible for. So this allows you to see whether it's a scholarship program, a loan repayment program, any of our grant funding opportunities, that this will allow you to see. Because we have so many programs that we offer, this allows us to be able to sort through that and guide you a little bit in terms of what programs might be appropriate for your as an individual or as an organization. I believe, and then I just again wanted to thank you very much for attending this time with us today. As was mentioned, we will post the recording and the slides after the presentation. Also, if you are interested in receiving our monthly update on our workforce programs, we encourage you to subscribe to our mailing list. The address is here. It's on our HCI public website at the top, and you can go to subscribe and then choose the type of information you would like to receive from us. So we encourage you to do so to receive ongoing updates. Thank you again for attending, and we look forward to receiving your applications. Thank you. This concludes our webinar.